Thanks for clicking the box there for some extra information about insurance. I'm going to try to keep this short, but dental insurance continues to change, and they continue to do their best to confuse you all and us. And I'm going to try to clear up some of the confusion. And for those of you who maybe work for Forsyth County school systems or for Baptist Hospital, you've got some pretty big changes coming this year, and I'm going to specifically address those issues. First of all, a word about our fees. Every year, I look at fees in this area, and I'm able to buy a report. This has all the ADA codes on it, and I set my fees literally right at the 50th percentile for every single ADA code. So I have not changed my fees in about 4 years. Those of you that pay out of pocket probably notice it's been the same for 4 years. I don't have any plans to change them anytime soon, but really I should do it every year. But our fees here actually are just a notch under the average for this area, which I feel plays well to the patients, because I do feel like we're a few ticks above average as far as most dental practices in this area. The other thing that you should know about our practice, we are not associated with any corporate structure. We are not involved in DSOs. This is our practice. Sydney, my daughter, and myself are the only dentists here. I'm the sole owner of this practice. Nobody is dictating to us what we can and can't do, what labs we can use, what products we can use. And we are now the minority, because almost all the other practices around here are somehow in a corporate structure, and some of them are in big corporate structures, especially in Winston, and they may not look like it, but they are. And I'll just leave it at that. There's a lot going on in dentistry, and the patients are the ones that are losing out because there's so many hands in there trying to grab for the revenues. So insurance. Forsyth County is doing away with all insurance, and they are apparently trying to push you all towards something called Pierce. Pierce is keeping you all confused. They're lumping dental and vision together, and you don't know how much is for this and how much is for that. Let me just say, if the yearly maximum is just $1,000, that pays for almost nothing. By the time you have your teeth cleaned a couple of times and maybe have a filling or two, you're maxed out. It's really not insurance, because it stops at $1,000. Now, there are plans that are much higher than that, but I believe the one with Forsyth County School Systems is $1,000. That's terrible. That's not even worth the trouble of having. Other insurances that, generally speaking, are not worth having are any private policy. If you don't have the strength of a major corporation or employer behind you, you're pretty much screwed. So keep that in mind. But if they only pay $1,000 or even $1,500, that's just not enough to really even get started should you have any kind of major problem. Like if you're in a car wreck and knock out 2 of your front teeth, $1,000 it doesn't even get you in the door hardly. And that's just the unfortunate way that it is. So the insurance companies have done a great job of making the general public think that they need insurance. But when you max out at $1,000 or $1,500 or $2,000, that is so low, it's hard to even consider it insurance. And keep in mind, dental insurance works the reverse of medical insurance. Whereas with medical insurance, basically the patient pays the first X dollars, and then insurance will pay the rest, way, way, way up, hundreds of thousands of dollars. Dental insurance works the exact opposite of that. So those of you that have Forsyth County school system insurance, I would look long and hard at going with that Pierce group, because if the maximum is as low as what I think it is, it's just not worth it. I would just pay out of pocket. And I'm going to show you a way that you can do that and save some money too. Those of you that have MedCost through Wake Forest, they are doing away with that. And generally speaking, Baptist Hospital has been pretty good to their employees. And even though I don't personally care for MedCost because of they're a little difficult as far as filing claims and so forth, once they do pay, they pay almost 100% on most things. So that's going to be switching to Delta Dental. Delta Dental typically is not an insurance company that most dentists like to deal with. There's lots of lawsuits against them. The American Dental Association has all kinds of lawsuits against them. There are states where they're trying to monopolize. They're even buying dental practices. So there's a big conflict of interest in lots of places around the country with Delta Dental. Not quite so much here in North Carolina, but in general, they're not a company that most dentists like to deal with. However, Wake Forest, Atrium, or whoever owns them now, has done a pretty decent job of coming up with a plan through Delta Dental that pays pretty well. And it pays the same in-network as it does out-of-network. I'm looking at the information that people that work there have gotten, and it pays pretty well, and it's the same in-network as out-of-network. The high plan, it looks like it's like roughly $30 a month, and there's a $50 deductible. You've got an annual maximum of $2,000, and it basically pays 80% for minor restorative procedures. That's like a filling or something like that. And then it pays 50% for major things like crown and bridge and that kind of thing. It does have coverage for orthodontics, I think up to $2,000 per year. Keep in mind, that doesn't even get you started as far as braces go, but it's $2,000. It's better than nothing. So this plan looks like it's pretty good. They will try to force you to see an in-network provider. What does it mean to be in-network, and why am I not in-network? I tried that for a number of years, and basically when you agree to be an in-network provider, if I charge $100 for something, that means that the insurance company is going to send me $60, and I have to write off the rest. So to you, the patient, it looks like they've paid 100%. They didn't pay 100%. They paid sometimes just 50%, and the dentist has to write off the difference. So in 2022, at the end of the year, I looked at the numbers, and I had written off $325,000. And that's just not sustainable. So the practices that are in network, what they do is they run more patients through. They don't allow as much time for things like getting your teeth cleaned, or for that matter, any other procedure. They use cheaper labs. They use cheaper dental supplies and products. They don't get to know you. They rush people in and out. They have to, because they're writing off sometimes as much as 50% of their fee. And that just is not sustainable unless you are doing mass volume. And I have found that when you're doing mass volume like that you are running a much greater risk of not thinking things through, not getting the best result, it's just a recipe for disaster. And these big corporate practices that are all in network, and they're all in network, they hire really young and unseasoned dentists who are strapped for money because they owe hundreds of thousands of dollars in student loan debt. That's a whole nother subject in dentistry that's a problem. But basically, they enslave them, and they make them do things faster than what they're capable of doing, what even seasoned dentists are capable of doing. And they create bad habits in them because they have to take shortcuts in order to make things work. But if you are an employee of Baptist Hospital and you go with Delta Dental, I would suggest that you go with their high plan. It's pretty good, and you don't have to go to an in-network provider. Even though they will try to push you in that direction, you do not have to do that, and the coverage is the same. And the dentist actually does get paid. If you go to a in-network provider, just know that that dentist doesn't have much of an incentive to really try and do a good job for you, because they're only getting paid a portion of their fee. So one thing that we do have for those of you that maybe, if you've got pretty good teeth and you've never really had cavities and problems, chances are that you're going to continue to not really have any problems. We have a program here called Healthy Smiles Advantage, HSA. I know it's an unfortunate acronym because people get it confused with their HSA plan for medical work. But Healthy Smiles Advantage is $35 a month. That gives you 2 cleanings a year. It gives you all exams at no charge, all x-rays at no charge. If it's for children, you get fluoride at no charge. And any other dentistry that you need is at 20% off, and there's no maximum. So, if you need 2 crowns, and that's going to be, basically $3,000 total, you're going to get a $600 discount off of that. Now, if you compare that to regular insurance, if you've got a $1,000 maximum, well, it's not much more, and you've maxed out your dental insurance. Plus, a lot of those plans don't pay 100% for cleanings, even though they say they pay 100% for cleanings. They pay maybe 75 or 80%, and then you have to pay the rest, even though they say they pay 100%. One of the things that these insurance companies do is they have what's called an allowable amount. And that's just an arbitrary number that they come up with. For example, a crown here in this office is $1,443, which is right in the middle of the average for this area. There are plans out there that say that the allowable amount for that is $600. And then some of them they only pay half of that. So for a $1,400 crown, they're only paying $300. That's not insurance. I mean, it's not. I think that it's wrong that they even use the word insurance, quite frankly. But this allowable amount thing, that's where the insurance companies are able to completely pull the curtain over everything so that nobody can make decisions based on true facts, because they won't tell you what that allowable amount is. If they'll say we're going to pay 50% of the fee, no matter what that fee is, then that would be great. But they'll say we're going to pay 50% of the allowable amount. Well, what's the allowable amount? Oh, well, we don't tell that. So we're all out here making decisions and trying to base the direction that we go in without really knowing everything. It's a big racket. And I can tell you that just if I were going to make a general comment across the board, there are exceptions to this, but just a general comment is that it's just not worth it. If you happen to work for a company like Baptist Hospital, and they do have pretty good coverage for their employees. They're an employer that I think does kind of care about who works for them. And if that's just a part of your compensation, then that's great. I mean, something's better than nothing. And in general, their coverage is pretty good. But if you work for a company that just kind of throws something out there, and there's a lot of them out there like this, and you're having to pay for it out of pocket, it's not worth it. I would just say, I don't want it. And either just pay out of pocket, or you can go with like our HSA plan. If you're somebody that truly is going to come and get your teeth cleaned twice a year, and there's a lot of you like that out there. Of course, there's a lot of you out there that have insurance and you don't ever go. You don't even get your teeth cleaned, and you're paying for dental insurance. But if you're somebody that's going to come twice a year, and you don't want to have to mess with not knowing about dental insurance, you don't want to max out when you've only messed with one or two teeth, our HSA plan is way better than anything else that you'll have out there. If for no other reason, then there's no maximum on anything. But a lot of you have gotten letters from me for about the last 4, 5, 6 months. If I get in an insurance payment for you and it's not very good, I've got a form that I fill out, and I say, this is what your insurance paid, this is what the charge was, this is what the median fee for this area is, and this is the reason why your insurance paid so little. And it could be that there's a high deductible. It could be that there's a low maximum amount. It could be that there's a low allowable amount. A lot of insurance companies, and this kind of blows your mind, in dental schools today, basically they don't even teach restoring teeth with old silver fillings. Amalgam is the word for an old silver filling. I haven't used amalgam in this practice in over 20 years. And it's not because I'm afraid of the material. It's because why would you want to put something dark or silver in your tooth when you could put something that's just as strong, that's tooth colored? I think most dental offices pretty much are just like mine. If you go to a dentist that still puts amalgam in teeth, that merits some questions, because even though I don't buy into the whole mercury thing, still, why would you not want a white restoration instead of a silver or black restoration? But a lot of insurance plans out there, if you go to put a white filling in a back tooth, they downgrade that to an amalgam restoration charge. Of course, it's not even what an amalgam restoration charge would be. It's even less than that. But it's hard to believe that there are insurance companies out there that downgrade restorations to an amalgam. That's something that's not even taught in dental schools anymore. And there are other tricks like that these insurance companies have to keep them from having to pay. I mean, really, I've said it 1,000 times. There's some insurance executives that really should be in jail, because I think what they do is just illegal, and it really upsets me when they're doing it to an older person that just truly doesn't have any knowledge to base decisions on. They're just really taking advantage of people. But I've been trying to give people an idea of looking specifically at their oral health. And I can say, well, in the next 5 years, I think there's 1 or 2 teeth that might need to have some work done on it. Or you've never had a cavity before. Why would you all of a sudden think that you would have cavities? Why would you even need dental insurance? I'm trying to give people an idea. If you have a question and want me to give you an idea of what I think might be coming your way in the next few years, I'm more than happy to do that. There's many of you out there, especially those of you that have been coming here for years. If there's been anything that you needed to have done, you've done it. So it's done and over with. It hopefully will last you the rest of your life. But I'm more than happy to look at your chart specifically to give you an idea of what I think might come your way in the next few years. And that can help you to make a decision on if you even want to think about having dental insurance anymore. In general, I think if you're paying more than $30 or $40 a month for dental insurance, you're probably paying too much. So again, if we had all the information, it would be easier to make a decision. I can certainly help you with where I think you might be headed as far as dental needs go. But we want everybody to have good oral health. We want to make money. We want our patients to be happy. We want to have a good relationship with everybody that comes in here. Fortunately, at this point, I don't have a lot of the overhead and so forth that younger dentists have, and I've been very fortunate in my profession to have a very comfortable lifestyle, and I'm very appreciative of it. And so that's one of the reasons why I hadn't upped my fees in 4 years. Most offices do that once a year. I just don't have to have it like I did 25 years ago, and so it's just not that important. I would just as soon come in here and do it all for free if everybody could be happy and have a good time. Of course, that's, there has to be some money being made, but nobody wants to come and swim in blood and spit all day long for nothing. But fortunately, it has been something that I have enjoyed doing, and I appreciate those of you that have been good patients here, and I appreciate those of you that have been seeing my daughter, Sydney. She's now here full time, and I will have to say, I guess I would say this anyway, but I can honestly say that I am very, very happy and tickled with her as a dentist. Of course, I always have been with her as a daughter, and I appreciate the way that you all have accepted her. It's allowed me to take a little time off. I'm basically only working 3 days a week now. I don't have any intentions of slowing that down anytime soon, but I appreciate those of you that have seen her. She has done a good job, and she is my dentist now, and if I need anything, she's going to be the one that's going to fix it, and I have no reservations at all in recommending her wholeheartedly. But I am still here. So anyway, if anybody has any specific questions about this, please let us know. I'm happy to answer as many questions as I can. I will be as forthright as I can be as far as insurance or anything financial goes. And as always, we appreciate you allowing us to serve your dental health needs. Thank you.